health insurance is going to cover it, because their health insurance, again, it's not looking for something potentially there. But when somebody tells me, you know, I'm fine, I'm a runner, I'm healthy, but, you know, I think heart disease like runs in my family. Like my, you know, you start seeing like my grandfather died when he was in his 50s. Then sometimes I'll say, you know what, just preventatively, like, let's just go do a stress test, or let's go get a CT angiogram. Let's just go look at those vessels. And I can't tell you, you know, that's been life-saving before. You know, all of a sudden we'll see that they have a major blockage in one of their vessels, and we just take them to the cath lab and get intervened on, get a stent, versus waiting till they have a heart attack. Now they have to have open heart surgery. And these are the things that I always like harp on, like, this is not happening in traditional medicine. So, you know, when you have the ability and access to, you know, other testing or somebody that can kind of guide you, it's so beneficial.
Mm-hmm. Okay. So let's talk about, so I mean, we can go into the kidneys and the heart and the lungs and all of these different, there's all these different diseases, right? But let's focus on one of the things that I've heard. I listened to some of your podcasts. I listened to what you say, and I've known this for many, many years, is the main cause of this disease or these things that are happening is inflammation. And how do you look at that? How do you fight that? What is your recommendations for fighting inflammation? And you know, how much does inflammation weigh in the scale of things as far as health goes for you?
Inflammation is huge, and inflammation is basically the foundation of like every disease. So it's so important to address it. And so many different things cause inflammation. And, you know, just so the viewers know, when we're talking about inflammation, we don't mean like my knee hurts. We're talking about inflamed cells, inflamed tissues. That's, you know, people that, you know, down the road, people that have diabetes, they have a ton of inflammation in their body. But even little things can start to cause inflammation. Heavy metals, just toxin. We eat food that's dirty. We are breathing air that's dirty. Stress will literally change the structure of our cells and create inflammation. And then inflammation is going to create accelerated aging. None of us want that. And then that's what's going to lead to disease. So I'm huge with inflammation, and, you know, getting a hold of it, being aware of it. And I would say my number one for inflammation is detoxing, doing a good, I use a 21-day detoxification program. And what it does is like cleans up your blood, cleans up your organs, and it gives your body a reset. So there's all different micronutrients in it. It focuses on blood, liver, colon, and then there's even like a weight loss element of it. But this is like foundational. I typically put every single patient through a detox and to help reset their body. And they, you know, you might not see physical changes, but we then will usually see it in their blood work. But I would say 99% of the time they benefit, and they can actually have physical improvements if it's weight loss, more energy, better mental clarity, less joint pain, better sleep, better hair, skin, nails. That's definitely my number one. I could talk all, you know, for the next hour on.
Well, that's important, because I mean, you got to start out somewhere, because look, we're all screwed up. We've been, you know, eating and drinking pesticides, herbicides, fungicides, germicides, you name it, on top of all the mass amounts of, you know, omega-6s that we're all putting in our bodies, and all these, you know, the what do you call it? The triglycerides, and just all of these horrible things that we're constantly eating, especially if we're eating out of the left side of our car window all the time, which a lot of us do. Let's just face it, you know, especially people who are busy out there running around, you know, and I do a lot of traveling, so I know that I don't get to eat as right as I'd like to. That is changing though, because I know that what I put in my pie hole is most important. But the detox is the beginning of that, you know, like, especially if you're my age, I've been soaking up a lot of bad shit for a long time. So we need to get cleared. So is your detox one of these crazy detoxes that are out there, or do you use a product? Do you, how do you do your detox, or is it proprietary secret?
No, I'm happy. I'm happy to share. My mission is to share health education with people and teach people how to be healthy. So I'm happy to share. So my detox is it is something that I actually developed with the lab. This is how passionate I have
Okay.
become with how important detoxing is. But it's shakes, it's clean eating. So you're gonna have like fruits, vegetables. You're gonna have some pseudo grains, which are like quinoa, lentils, wild rice. It's lower protein initially, and then you're going to start adding in lean protein later because a lot of detoxing takes place in your liver. So it's not like starvation or anything like that. It's not just juices where you're like
Yeah.
ravenous.
I did that damn lemon thing one time for those 4 or 5 days, and it damn near killed me. I'm sorry. I can't believe I was like, is this thing for real? Like my wife was like, okay, so what you're going to do is you're going to drink this lemon water. First, you're going to down a gallon and a half of salt water in the morning. I'm like, how can that even be fucking good for you? A gallon of salt water, right? And so down this stuff, of course, the salt water, because of, I guess, the weight of it, or it goes right through you like whoosh, right? And then you drink this lemon water, and then you have like your nutrients for the next 4, 5, 6, 7 days or whatever is maple syrup. And I got to where I can't even smell maple syrup anymore because that shit was so awful.
Oh gosh. No, whenever I say detox to or a cleanse to a patient, first I have to defend it because I always hear like stories about like this stuff that's on the market. So this is also meant to be sort of a lifestyle change. So it's not like torture,
You've got to. You've got to have a lifestyle change. I mean, it's if you do it once, it's like, okay, I did it, so I'm good. Check. No, 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 no. If you're really that focused on it, I think it's time for a lifestyle change if you're going to detoxify
Yeah.
yourself.
Well, and then so you can like balance your life. We all want to go out to dinner. We all want to splurge. We're getting into holidays now. Like,
Oh
we
yeah,
want that balance. So like go out, go have your good dinner, but then, go back and do your shakes for a few days to like balance it out a little bit. The reason that I made this 21 days is for something called neuroplasticity to kick in. And that's where your brain actually starts to create new habits. So when you start this, the first few days are a little rough, you go through that detox, but then it starts to like, okay, I'm kind of getting used to it. Then before you know it, you're adding in more proteins. And then by the end, you're actually feeling better. And then you're like, okay, like I think I could actually keep going versus doing like, a 3 or 5 day thing where the only thing that's going through your head is, I can't wait until day 5 and I can go, back to my eating.
yeah, yeah, yeah. No, that's it is a lifestyle change. If you are going to detox, now you said something interesting to me that I want to talk about too a little bit. Is you said your detox it also considers diet. So you said vegetables, fruits, these kinds of things. Now I know what's in our vegetables and fruits. Our vegetables and fruits are loaded with garbage all over the top of them. What is your suggestion? Organic, because then here's another thing. Now, the community that we're talking to is a very wealthy community. Some of the people in here are very, very wealthy, and money doesn't matter to them as far as their eating goes, and they can afford good food. But let's just face it: the normal family of 4 or 5 can't just throw organic everything and farm raised this and free range that on the table when you're feeding your kids and everything. So, what's your solution for that? And what do you think about the chemicals and all those things on the vegetables and the fruits themselves?
Well, that's a very unfortunate, what goes on with that. Way back when I was in school, I actually took a whole class and researched, what the FDA considers, GMO and all of this stuff. And it was quite scary to read what is actually acceptable to put on the market and basically, not really be so truthful on the label. But I always say everything balance it. So, there's certain things that you should try to always get organic. Maybe not if they can't afford it, don't get everything organic, but they have like the dirty dozen list and, things like celery or strawberries those should always be organic. And then try to do things like avoid canned stuff. I mean, some people are still eating out of cans, and that's like aluminum, that's heavy metals that your body's just going to leach up and it's going to sit in your organs. And that's why, again, I talk about I talk about doing a detox program, because that, you know, it's you're taking supplements, you're having shakes with these powders. That is what I want to get in your body. And then we make the best food choices along with that. But this is what's going to help to clear it out, reset. So, you know, even if, people have a limited budget, if they can afford something like doing a detox like twice a year, that's also going to help, keep them healthy.
Nice. All right. Well, I am not I mean, I'm an advocate for, being very, very careful about the fruits and vegetables, and I mean, even the meats that you put in your body, but I've always found it hard to do it right for a whole family. And like you said, it's like, do it as right as you can, as often as you can. And in some areas you just can't get away from it, but get rid of some of the things. Now, let's talk about these heavy metals. That's a kind of a controversial subject with some people. Some people, it's BS, and some people it's real. And where did you hear about it? What's the science behind it as far as you're concerned? And what's it mean?
So I learned about it in school in some of like my fellowship programs, and basically different heavy metals where we can find them in our air, in our water, in our food, and the things we're putting on our body. What they do is they start to accumulate in your body and sit on different organs. And what this causes is accelerated aging, increased risks of cancer, cardiovascular disease, Alzheimer's. And there are studies behind this. Now, the way I kind of view it is, well, okay, let's say somebody tells me I'm toxic in heavy metals. So what's the treatment for it? Well, the best treatment is intravenous chelation therapy. And who uses chelation therapy? So let's say I tell you, I think you're toxic in heavy metals. And you're like, that's crap. I don't even know what heavy metals are. Well, let's just do this treatment. Guess what? In Western medicine, they actually do, cardiologists use it for cardiovascular health. They're now using it for diabetic neuropathy. So, even if people want to accept it or not accept it, and let's just do the treatment is so beneficial for your health that that's one of the ways I look at it. I definitely think it's a real thing. I've seen it, patients subjectively report feeling better, having more mental clarity. I actually, kind of moving into the treatment side of things, I've treated patients with the same treatment for it that have Lyme disease, that have chronic fatigue syndrome, and we've seen improvements in their outcomes. And then obviously, even if they are interested, and if they aren't interested in it, we bring those metal levels down. So I don't know if I answered your question. I feel like I always end up on all these tangents because I get so excited.
Well, no, you did, because so your detox includes, these shakes, probably some detoxifying, elements that are in your shakes, or in the shakes. And then of course there's the preventative, or not the preventative side, but the actual, like you said, the Western medicine side, where they're doing this chelation therapy, almost like what would you call it when you run a dialysis type of situation, where they're actually chelating your blood, right?
Mm-hmm. Yeah,
Okay.
it's like an IV drip. Like when you go in and get IV vitamins, it's similar to that. You give it slower. Sometimes there's different chelating agents that we choose based upon, the diagnosis. And like what I do is I'll do like a series of 10 infusions over, every week or every other week. And then we recheck your metals and then see where you are.
So when you run these tests, you look at all different types of metals in people's bodies: iron, lead, mercury, all these things.
Yep. Arsenic, aluminum.
And what do you typically, so you run these blood tests on people. What do you typically see in people when you guys run these tests?
So
high levels on everybody, or like this guy's high and this guy's not, this gal is, this gal, what do you see?
I see it varies. I would say of the heavy metals, I usually see the most, like the highest levels I usually see are like mercury and aluminum. A lot of people don't know that with aluminum, that comes straight from your deodorant. So if you use antiperspirant deodorant, the antiperspirant component is straight aluminum. So just like rubbing it right in your body. Luckily though, the market is aware of this now, and there's a lot of non-antiperspirant deodorants. But anyways, mercury, aluminum, lead to some extent.